Hi, my name's Elizabeth Wilkins McKee, and I'm the founder of the Parents and Children Project. Look, we got a lot to say tonight, and we're really going to tick some of you off. So buckle up, everyone. There are moments in professional life when silence and subtlety are not called for. This is one of those moments. Some of you, as I've mentioned, may decide to no longer associate with us or work with us after hearing this message this evening. That is the cost of speaking up for what is fair, just, right, and loving. To our community, especially to our queer, trans, and non binary community, we are with you in heart, in mind, and in action. The recent 8-1 ruling by the U.S. Supreme Court in Childs v. Salazar has landed as a gut punch to the field of mental health. We feel that here. Many of you feel it in your bodies, in your homes, and in your sense of safety. To those of you who are younger, I want to say this. One of the reasons we love working with you is because you are the future of this country. And one of the things we also hope to teach you over and over again is that adults make mistakes, sometimes big ones. Groups of adults, especially those in positions of power, can and do make decisions that cause harm. This ruling has hurt people. So we're going to break this down to understand what this decision does and does not change and what you can do to stay safe. This case was framed as a question of free speech. The Colorado law they're referring to was passed in 2019. It prohibited a licensed counselor from engaging in conversion therapy with minors. That same law allowed providers to offer acceptance, affirming care, identity exploration, and assistance for those undergoing transition. The law did not restrict care, it restricted harm. The court's holding was narrow. It determined that banning conversion therapy, as applied to talk therapy, regulates speech based on viewpoint. Okay, here's the deal. That's a legal argument, people. It's not a clinical one. The court did not determine that conversion therapy is effective. It did not determine that it is ethical. It did not determine that it is safe. Courts decide laws. They do not decide ethical care. Ethics are the responsibility of the provider and the provider's profession. Here's what we know. Conversion therapy, there's no difference of opinion. It's not an unsettled issue in my field. We know it's harmful. To that end, I really want to refer you to Dr. Raquel Martin. She has identified it as torture, and the United Nations defines torture as the intentional infliction of severe psychological or physical suffering for the purposes of forcing someone to change their identity or beliefs. Again, I want to refer you to Dr. Raquel Martin. She breaks that down really well, very clearly, very ethically, and very, very precisely. But what we're going to talk about now is we're going to talk about safety. Okay? So licensure doesn't mean that you are guaranteed to be safe around a provider. It doesn't guarantee much of anything other than we've met the basic minimum requirements. For most of us in mental health, it means we've done advanced training after graduate school. Some of us have been in graduate school for longer. We were supervised, so that means we reported to someone else, and we took an exam, okay? That's all. It does not guarantee that providers are ethical. We're trained in ethics, but it doesn't guarantee that we're also affirming. It doesn't guarantee that you're understood. In fact, I would say, you know what? You're not going to be a good fit with every psychotherapist, and that's okay. That's okay. Your job is to figure out, do you feel safe? Do you feel heard? And do you think this person is someone who can help you? People with licenses, though, you need to know we can cause harm. That's part of things. So the question isn't, is this person licensed? Although I will say that that is an important question and something you want to know. But if you're seeking care, you want to know, are they safe? You're allowed to ask direct questions and expect direct answers, and you're also allowed to leave. And for those of you who struggle to leave a difficult conversation, I encourage you right now, tonight, practice leaving. Sit on a couch, stand up, hold your head up, and walk straight for the door and close it. Practice multiple times because you do get to leave. Psychotherapy is a choice most of the time. So, here's some questions for psychotherapists if you're concerned about your safety. Okay. How do you understand sexual orientation and gender identity? Do you believe these should ever be changed in therapy? What does affirming care look like in your practice? How do you approach someone who's questioning their identity? What do you do if a parent asks you to change a child's identity? Ask and then listen carefully. You don't need to debate with a provider. Your job is to just trust your gut. And you know what? Go with it. Okay? You do not need to convince a provider of anything, really. You need to decide if you're safe. That's step number one. If you are currently in a situation where someone is trying to change your identity, chances are you're not the problem. Your distress may be a response to being treated as something that needs to be fixed when that's not, in fact, the case. You deserve care that supports you, not reshapes you. If it's safe, tell someone you trust. If it's not safe, focus on reducing harm and finding even one place where you are seen accurately. So, we are specifically talking about gender identity and sexual orientation. Please be careful about how this ruling is described and how you describe it publicly. The court did not say conversion therapy is acceptable, ethical, or anything like that. It addressed the legal question of speech. That's it. That's not the same as endorsing a practice. We would like to believe that the rule of law is always fair, just, and that we agree with it. We don't. But you know what? Here's the thing. The good news is that ethics are the responsibility of professions and communities. At the Parents and Children Project, we stand in solidarity with our queer, trans, and non-binary community. It's not acceptable to deny someone their identity. It is not acceptable to change identity through suffering. It is not acceptable to provide care that harms for the purpose of change. To those of you who are younger, we need you. We need you in this field, in medicine, in mental health, in law, in education, in research, in policy. Systems change because people refuse to continue harm. Here's where we land. Conversion therapy is not a gray area. The harm has already been identified. Good care does not ask someone to become someone else in order to be acceptable. Good care recognizes your sexuality and your gender identity as you are and supports you in fully living. We are here with you. May you be well, and please, please stay safe.